Hey everybody, Dr. Alan Bucola, physical therapist here. This week's video, I'm talking about transversus abdominis activation, just to help with people out there who are trying to build a better body awareness of activating that muscle, turning it on. That's a very common thing we do in physical therapy clinics and is often a precursor before going into more complicated core training protocols. And for some people, you can pick it up really quickly. Other people, it takes a little bit more time. So I encourage you, if you need to watch this several times just to put some thought into it, but sometimes it just takes a lot of repetitions to get a good sense of what your body is doing. So without further ado, so transversus abdominis is the deepest layer of abdominal muscle. We're talking about the abs, the abdominal muscles. We're talking about right here, right over the belly, everything between the rib cage and the pelvis. Transversus abdominis is the deepest layer. That means it's closer to your innards or to your vital organs. We often think about six-pack abs. That's your rectus abdominis lying on the very front. And then we've got our external obliques, internal obliques. And you can sometimes, we'll see those and really fit athletes on the sides over here. Your rectus abdominis, your external oblique, and to some degree your internal oblique, all of these muscles, when you contract them, they are going to approximate your pelvis to your rib cage. So you're going to bend and bring those things closer together, which results also in some changes in angles or position of your spine. What's unique about transversus abdominis is that the fibers run side to side, left to right. So when these fibers contract, much like a balloon, they pull the belly inward and more flat, which is a very unique function. So it's more responsible from a muscular standpoint for controlling the abdominal wall, whereas a lot of the other tissue that gives control to that is passive tissue. So there's a unique relationship between transversus abdominis and the diaphragm. If you were going to cut me in half like an old Victorian magic show right about the rib cage, you would see that big flat muscle, the diaphragm muscle. When the diaphragm is contracted and pushes down, that opens up your thoracic area and allows the ribs and the lungs to expand quite a bit. But for it to be able to do that, it has to push a lot of stuff here outward, because that's the only place for that stuff to go. It can't go back because of your spine, your ribs, your muscles, and it can't go down because that's where your pelvic floor is. So you'll see natural expansion of the belly as the diaphragm is pushing down. So simultaneously, when you have the diaphragm contracting and pushing down, you'll also see the transversus abdominis is kind of bulging outward at the same time. So they have this relationship where they move in sync together. The diaphragm brings air into the body, and transversus abdominis helps from a muscular standpoint to push everything back out. So sometimes we use breathing as a technique to build awareness of that muscle. That's one way. Today we're going to talk about a couple of other ways that are easy to do that. But I want you to think about the visual of what the muscle is doing, because that will kind of help tell you if you're activating the right abdominal muscles. Keep in mind the other big three that are more superficial, those are designed to approximate your pelvis to your rib cage. So if you're firing those, you're going to start to almost see like an abdominal crunching motion, whereas if you can isolate and contract the transversus abdominis going this way, you shouldn't see any movement in your ribs or your pelvis or your low back when you get a good isolated contraction of that. A good position to start with for people who are having trouble with this is in quadruped or tabletop, if you will, because that allows gravity to put stretch on the muscle and pull the muscle down. And then when you go to contract it, you have some resistance to push against, which can give you a little bit more awareness of it. So I'll show you that right now. And I'll raise this up so you can see my belly, because that's an important part. And again, before I get to the position, as I take in a big breath, diaphragm pushes down, which pushes all of this stuff outward at the same time. So a big breath would go in and then out. And then I can follow that breath, contract the muscle, and pull everything inward a little bit. So again, in and out. And that's all we're doing in quadruped is we're working on this isolated portion, that isolated contraction of the muscle, drawing those muscles in. So if I'm in quadruped doing this, it gives me a little bit more feedback where I can feel the muscles working. I can inhale or just let my belly drop down and then contract the muscle and pull it upward. Down or relaxed and upward. So breathing is a great way to start to build some awareness of this muscle. However, when you feel like you can make a really good contraction with it in isolation, you should move that to more challenging positions, whether it's going from quadruped to sitting, like sitting in a chair. And then an even more challenging position would be lying on your back because gravity is already kind of bringing that muscle to that position anyway. A lot of times when people will begin this activity, they'll feel it a little bit more kind of up here, and they'll get some of that more upper part of the muscle drawing in. But as people practice and do more of it, you should be able to feel it even down closer to the pelvis bones that go right under the waistline. You'll feel that muscle right at the waistband kind of pull and flatten in. So that's a great place to put fingers. And a couple of ways that you might also naturally get some activation of this muscle if you're not sure what it feels like. Sometimes taking the time to blow forcefully, suddenly, you should automatically get some contraction there. Just doing a gentle, you watch that muscle through here. That gives you a chance to feel what isolated contraction is there. Or you could even try to do like a ha, ha type motion, which if loud enough, you should also get some activation there. So start with that. Like I said, sometimes people get it really quickly. Other people, it takes lots and lots of practice over the course of a week or two. And then once you can perform that contraction in isolation, then just keep practicing being able to contract, relax. And that's a great foundational first step before you get into some more complicated core training. All right, thanks for watching and good luck.